Hello, and thank you for listening to today's episode of JATCast, the official podcast of the Journal of Athletic Training. I'm your host, Luke Donovan. For the second episode of the month, I will discuss another article from the recent issue of JAT titled, Collision and Contact Sport Participation and Quality of Life Among Adolescent Athletes by Dr. David Howell and colleagues from Children's Hospital Colorado and the University of Colorado School of Medicine. As a reminder, the article discussed today can be found on the JAT website, natajournals.org. And please remember that all content from JAT is open access to all readers thanks to the funding from the National Athletic Trainers Association. First step, surveying the scene. Approximately 8 million students participate in high school athletics. In general, physical activity and sport participation are associated with multiple benefits for youth, such as improved physical health, reduced risk of obesity, and decreased rates of smoking and drug use. On the other hand, youth athletes may be vulnerable to a variety of traumatic and repetitive stress injuries, which could lead to chronic pain, decreased function, and risk of re-injury as an adult. Collision sports in particular have continued to be studied due to the concerns of exposure to repetitive head impacts. As such, most researchers have focused on the association between collision sport participation during high school, such as football, and neurological outcomes during adulthood. Despite the focused attention, there is no clear consensus as to whether participation in football, regardless of starting age, is associated with neurological outcomes such as neurocognitive function. Perhaps broadening the focus and studying quality of life throughout athletic participation and across athletes who participate in other non-football collision and contact sports, as well as no or limited contact sports, to help inform relevant stakeholders regarding individual decisions on which sports to pursue during high school. The primary purpose of this study was to examine whether current participation in collision and contact sports during high school was associated with short-term quality of life ratings relative to athletes who reported current participation in no or limited contact sports. The secondary purpose was to determine whether the exposure to repetitive head impacts that typically occur in collision sports was associated with short-term quality of life outcomes relative to no or limited contact sport participation. Study questionnaires were completed by high school athletes from a single school district who were undergoing a pre-participation physical examination during May of 2018 and May of 2019. To be eligible to volunteer and participate in the study, athletes needed to be between the ages of 13 and 18 years and receive full clearance to participate in sport at the time of examination. Athletes with pre-existing neurological or psychiatric disorders or a recent concussion diagnosis with ongoing symptoms were unable to participate in the study. All participants completed a set of standardized questionnaires during their exam that documented their medical history, demographic characteristics, and quality of life. Example variables included sex, age, average training time per week, level of competition, and the different organized sports in which they were involved during the year preceding the evaluation. Participants, and if needed with the help of their parent or guardian, also answered questions to determine their lifetime injury history. Quality of life was measured using the Patient-Reported Outcomes Measurement Information System, or PROMIS. This instrument assesses 6 domains: physical function mobility, anxiety, depressive symptoms, fatigue, peer relationships, and pain interference. A single question addresses pain intensity. The primary study purpose was completed by dividing participants into groups. The participants were divided into either the collision contact sport group or the no limited contact sport group. The following sports were considered collision and contact: basketball, cheerleading, diving, extreme sports, football, gymnastics, lacrosse, martial arts, rugby, soccer, water polo, and wrestling. All other sports were classified as no or limited contact. To be in the no or limited contact group, the athlete needed to participate exclusively in no or limited contact sports. To answer the secondary purpose of the study, the investigators grouped participants who reported collision sport participation in the past year and compared them with no or limited contact sport athletes. Example collision sports were football, rugby, boys ice hockey, and boys lacrosse. Specific to the study, no rugby or ice hockey athletes participated in the study. Also, the authors removed any participant with a history of concussion given that the specific research question pertained to the effects of repetitive head impacts on quality of life. Finally, only males were included in the secondary analysis due to no female participation in collision sports from this cohort of athletes. Here are the results. A total of 281 adolescent athletes participated in the study, where 143 reported being part of collision and contact sports. Stratified by sex, 76% of the male participants were in the collision or contact group, while 24% of female participants were in the collision and contact group. In addition, a higher proportion of collision and contact sport athletes reported a history of time loss, bone, muscle, ligament, or tendon injury, or a history of fracture or dislocation than did the no or limited contact sport athletes. However, the groups did not differ in the proportion of athletes who sustained a diagnosed concussion. After controlling for covariates such as age, sex, and injury history, collision and contact sport participants reported lower anxiety and depressive symptom domain scores than the no or limited contact sport group. Of the covariates, female sex was significantly associated with higher anxiety and depressive symptom scores, whereas a history of musculoskeletal injury was significantly associated with higher pain scores. A total of 93 male athletes met the criteria of no history of concussion and were included in the secondary analysis. Of those 93 participants, 55 were in the collision sport group and the remaining 38 were in the no or limited contact sport group. After adjusting for covariates, collision sport participation was significantly associated with lower anxiety scores and higher pain scale scores. Also, more athletes in the collision sport group reported a history of time lost bone, muscle, ligament, or tendon injury than the no or limited contact sport athletes. When interpreting these results, the authors remind us of a few study limitations. First is that the promised outcomes reflected attitudes in the week preceding assessment and thus represent a situational assessment rather than a trait assessment. Also, given the study design, no causational effects should be inferred. And finally, the association between sport type and measures of quality of life are likely multifactorial, where other factors that were not included in this investigation, such as socioeconomic status, sport availability, race, and ethnicity, may also contribute to quality of life. What we can take away from the results is that there are some elements or characteristics of contact and collision sports or adolescents that choose to participate in these sports that could explain the lower anxiety and depressive symptom scores when compared to participants of no or limited contact sports. One potential factor could be that most of the contact or collision sports included in this study are team-based sports. Previous studies have found that individuals in team sports often document fewer anxiety symptoms than athletes in individual sports. From the athlete characteristic standpoint, perhaps individuals who choose to participate in contact and collision sports inherently have fewer anxiety and depressive symptoms than those who choose to participate in non- or limited contact sports. As expected and previously reported, athletes from collision and contact sports reported a higher proportion of time-lost musculoskeletal injuries than participants of no or limited contact sports. Intuitively, many would assume that greater prevalence of time-loss injury would correspond with greater levels of anxiety and depression symptoms. However, that was not the case in this study, as the findings of the study were actually the opposite. It is important to note that many of the consequences of musculoskeletal injuries, such as osteoarthritis, may not become symptomatic until many years after the initial injury, and therefore the decreases in quality of life that often accompany diseases such as osteoarthritis may not occur until later in life. Specific to the secondary purpose targeting sports with likely repetitive head impacts, the findings essentially mirror the findings of the primary purpose, where individuals who participated in collision sports had less anxiety symptoms, but greater reported pain than athletes who exclusively participated in no or limited contact sports. Once again, the authors attribute these findings to the potential additive benefit of team-based sports and that individuals with lower anxiety symptoms may have a greater likelihood of participating in collision sports. This study highlights the potential positive and negative effects of collision and contact sport participation. Going forward, teasing out the causative factors and continuing to limit injury during sport will help continue to maximize all the benefits of sport participation among adolescents. Well, that's it for today's JATcast. Please remember to rate and subscribe to the podcast, which is available on iTunes, Google Play, Spotify, YouTube, and Stitcher. You can find out more information about upcoming podcasts and other JAT events on our Twitter, Facebook, and Instagram accounts at JAT_NATA. Thank you for listening and keep a lookout for next month's JATcast.